So first of all, thank you for being here. Welcome to the Thoughtfully Forward story series. And the goal of this first and foremost Thoughtfully Forward story is to really tell the story of Matibabu and Brian from Uganda that are pushing non-intrusive malaria diagnosed technology to really push forward solutions in the malaria ecosystem. We have Brian with us on the call. And Brian, just to start and sort of the world gets to know a little bit more about you, would be great if you can introduce yourself, your role in Matibabu, and talk a little bit more about who's Matibabu and you're trying to achieve.
Thanks so much for having me, Pedro. Sure, my name is Brian Gitta, and I'm team lead at Matibabu. And generally, Matibabu is the company that is aimed at closing the gap between the communities and their rightful access to healthcare. So Matibabu does that by producing technologies that help in delivering perfect healthcare in these communities. And one of the technologies is the Matiscope, the non-invasive malaria diagnostic kit that is aimed at offering a quick and robust malaria diagnosis, but also building up an ecosystem around malaria and supporting the surveillance into digitalizing that process, as well as making sure that the people have a complete path from when they get to know they have malaria till when they get the medication, and that process is smooth for them. As a company, we've been in existence for more than 7 years now. And we have been able to go through about 5 generations of prototypes. What that means is we have created 5 different generations of the prototypes, which we have tested, got insights and iterated. Of those 5, privileged to have worked with you, Pedro, on the 2 most recent, which really one helped us rethink the process of manufacturing, but also helped us realize some of great products in terms of marketing, in terms of product defining, in terms of attaining some of those key milestones in the technology as well. And currently, we are still in processes of clinical testing that's gathering as much data as possible on the device so that we can be able to ascertain the efficacy of the device in terms of sensitivity and specificity before we plan on going to market. So in a nutshell, that's it about me and the team, and we are based in Kampala, Uganda.
Great. I think, I remember when we met in 2014 at the TEDx in Luanda, and I heard you share this story of Matibabu, and I think that's where kind of like everything ignited, and we're really connected at a deep level from the impact that the technology can have. And it's been really fruitful to follow Matibabu's progress and how you've been pushing forward as well. I think because we know very well, like kind of your origin story, like would be great if you can just pack like what led you to build Matibabu technology, like where does that come from, and like what sort of originated that push forward?
Sure. I mean, that's key. And before we jump into that kind of story and drive behind the whole company, it's key to also mention, I think, the power of networking and the power of socializing within the ecosystem of development and ecosystem of developing devices as a startup. Because at that time, before we actually met with you, Pedro, we're in a process of with one of our funders looking for a manufacturer to see that we cover the capacity gaps that we had, but also to see that we move to the next step of really developing something concrete from the breadboards and kind of Arduino boards that we're trying to manufacture and really engineer. But the funny part is that we didn't go out strongly wanting to meet Pedro, but rather than this built up from TEDx Rwanda, the connection and experience shared in that space is what led to a collaboration that led to the devices that are into clinical trials now.
Cool.
So I think it's really, really key to put yourself out there. We were both putting ourselves out there and we needed something and you were able to offer it, and that was your space, and you could be able to offer it, and I'm thankful for that.
Cool.
So, but anyway,
Yeah,
so the
maybe Brian, I think you brought a really interesting point. So let's just flow with that. And I think because one of the goals of this series is also, to help others sort of inspire action. And I think you were a great example of, putting the word out there, like talk about your technology, talk about your ambitions. Like I remember you also were involved in several programs around the world that were helping, health technology being developed. And I think sometimes people are a little bit more afraid to sort of go out in the public and talk about what they're doing and trying to do. And I think you're a great example of like the impact that going out there and talking about the ambitions and the vision of what you're trying to achieve is a great way for you to connect with mind-like people that might just help you get that thing moving forward. So I think that's a great point, and I really appreciate you bringing that to our attention as well.
I mean, because your technology is as great as the impact it makes, and if you get scared to go out there and share what you're working on, many people cocoon and they want to really come out with the final product, but you may not be as privileged as the startups or some folks in different ecosystems that have financing readily available. So the only option you have is to really aggressively go after these events, these partnerships, and make sure you make them work. So yeah,
Cool.
that's really true. So, but to jump back to the question, I mean, I come from the background we all have on the team. Most of us is computer design, computer science. So coming from that background and having grown up in the sub-Saharan region, we have seen firsthand the challenges when it comes to diagnosis of diseases. We have seen how broken these health systems are. And sadly enough, it's not only our region that with this pandemic of COVID-19, we have been able to see that the whole health system is broken. So for the context of where we come from, we had seen this over and over time with the broken health system when it comes to malaria diagnosis, because we have all firsthand experienced the disease, and we have grown up seeing all these challenges when it comes to diagnosis in terms of time, waiting, and the process. I mean, fact is that over time we have seen a great shift in the medication for malaria, but we haven't seen a great shift in the way the diagnosis was being done. So doing this all around, and also the experiences we had and the love for technology that we had, we decided to pursue disease diagnosis as a major category. And then we zeroed down to malaria first because we all have these experiences, and it's a big killer disease within the region. So that's how we all started off with Matibabu. And eventually it started off as a project that then further along in 2013 that we incorporated as a company.
Great. So yeah, I think, I really connected with sort of the origin story when we met in TEDx Luanda. And like, I mean, like I think from a macro perspective, the impact that technology can have, from improving the diagnosis, and the fact that is a non-intrusive malaria diagnosis is really, enabling a whole new level of reach to, as you said, and as the branding sort of structures into Matibabu, which is, enabling this rightful access to health at scale. So one of the questions we had here, and I think I'm really excited to talk about this because, since we work on branding together and like in a very close collaboration, like one of the big sort of discoveries that we did with you was, this macro vision of Matibabu and fighting for the rightful access to health, and, being Matibabu technology a platform for that. Like, since last we connected, which has been, I would say probably about a year or two, like what have you been doing and how are you fighting for the rightful access to health?
Building up from that question is communication is one of the hardest things that startups face. And that is mainly communication, and it's a burden or a problem for startups within the region. By region, I mean sub-Saharan region. So even the startups with products, even the companies that are struggling with products, they really find it hard, one, to communicate how the product is supposed to work, and
Mm-hmm.
two, how to communicate to investors, and how to communicate to the public, because we realize that you have to really communicate differently for these two other people.
Mm-hmm.
How you really come out, which image you portray, and what you stand for. And to us, that's one of the things that we were able to change while we were working with PGD. I mean, we're able to really build a strong branding line, which changed our social media, which changed the way we went in for communicating on our websites. It also changed the way we were pitching, because we were able to create many resources with you. We created pitch decks and well articulated pitch decks. And this creates kind of this uniformity, and it doesn't have to be me, Brian, that is talking, but whoever in the company that is pitching knows the direction that we are supposed to take.
Cool.
If you're talking to an investor, you know the direction you're supposed to take, and you have all these guidelines, and you understand. So that we are not communicating something different, we are all saying the same thing. And we need tools to empower us to do that, as simple tools as pitch decks, master slides. I mean, you can change them because information changes over time, but you need to the industrial design for people that are developing a product-driven companies. You need all these industrial designs so that you can sell this vision to people, and they buy into this. So, I mean, from the time that we launched, it was very, very evident. I mean, we have given other bigger TED Talks with these materials.
Mm-hmm.
I mean, we have been named Rolex Laureate of 2019 with such materials, and also that helped us really articulate the technology in the right direction. So I think it's that there's power in branding. There's really power in the information and how you package that information that you put out there, that many people do not look at. It's not all about having a device or technology working, but it's also how you sell that technology to the people and how they get ready to consume that technology.
Cool. So yeah, I think, as we typically say, clarity drives consistency, and consistency drives trust, and trust drives growth. And I think, as just referring back to your point, I think, we worked very closely together. I really remember all the workshops and all the sessions to really use design as kind of an enabler of the core that already existed in Matibabu, and sort of bring that together as a clarity in terms of brand messaging, and to really find your core and sort of enable that origin story. Like, one of the questions I had here, maybe we can run through like organically, is like, beyond the technology, was there any other initiatives that you've been doing as a company to sort of stay close to your community and sort of close this gap? I know you're currently trying to push some great work to help support the COVID situation that's happening currently in South African region. Like, what other initiatives and what other actions have you built that sort of support this brand umbrella?
Initially, as we're developing this, we thought, for example, the surveillance dashboard platform was supposed to only be used by us internally
Mm-hmm.
to map our clinical studies. But over time, we have launched this digital surveillance tool that we are calling Yota under Matibabu,
Cool.
and launched it out to the public. And this is just to help in drive the surveillance, not only around the Matibabu kit, but also around the strips and around the microscopy, so that we collect this data in real time and we support those hospitals at the last mile,
Mm-hmm.
and gather information so that they can report consistently at the national level and the national databases. We launched this actually last year in November, and we have collected over 40 information back to a year of over 45 hospitals, and which is really, really coming out well. Working with a few pharma companies to see how we can start doing product performance for them and things like that. So
Cool.
that's one of the things that we've been pushing within the brand of Matibabu. With one of our partners, Royal Academy, we have also we are working on how to give back to the community during this Corona time. So we are working on reusable 3D printed masks,
Mm-hmm.
producing those and giving them back to the community, but also working on how we present data on COVID, to other service provider and how we can plug in to help create systems that help government officials like deliver services when it comes to COVID. So that's some of the community engagements that we have on top of the clinical studies. That is the main community engagement that we have in Uganda. Actually, we also, with Unitel, hope I'm pronouncing it right, we've had a full engagement with them in Angola, and we are going back to do a clinical study there as well, which is awesome. But because of COVID, it has been pushed forward, but those are some of the things that we've been working on.
Great. So really, really exciting to hear as well, like, that you're really also looking at technology as a platform to go beyond just the hardware and the, malaria diagnosis technology. So I think it's a great lesson as well from your side that you're also using your resources and your team and your capabilities to sort of give back to the community. So really, really inspired by that and really thankful for that, Brian. And I think one of the last questions we had, how do you envision a better future? But most importantly, like, what do you believe it takes to make it happen? Like, what are the one or two or three things that, us as individuals and us as brands and us as companies that we need to sort of push forward to make it happen?
Sure. One of the biggest thing is your clients. I mean, the more you understand your client, the better as a brand you will be able to serve those clients.
Cool.
So building those community relationships is really, really key. The more two-sided relationship you're having with your community or with your clients, the better the products you push to them, because you really understand their needs and you're not coming from a place of assuming. Two is consistency, really. I mean, things may not work out in the first year, things may not work out in the 50th year, but you have to keep at it and understand why it is not working out as planned, and then channeling that energy into making sure that you learn and improve, so that you do not stay constant in the same situation, and to learn when to improve and when to really change. I mean, timing is key, and it's key that you follow up on trends and you're persistent. You definitely then start penetrating those markets.
Cool. Yeah, I think you mentioned an important part that we believe is also like really important and pushing forward. I think you're a great example of resilience, like pushing forward a solution to a very important problem and just growing through the hustle and the journey of pushing that through from Uganda to the world. I remember you were in Germany, you were here with us in Portugal, like you were at times, like you got a lot of powerful exposure and connections and networks. So I think you're a great inspiration story for that. And I think you should celebrate that as well. And as you said, consistency and adapting to the ecosystem and to the changes that the markets or the context flow. I think it's a great lesson and it's a great suggestion for action forward. So, just to wrap it up, if you're in the audience, you have like someone, a student or an entrepreneur that is stuck in one thing that I think you guys did right, which was going out there and talking about the things that you're doing, but you're talking to someone that is either afraid to go out there or just afraid that it might just not work out. Like, what's your one suggestion or one recommendation to sort of ignite that person to move forward and drive the next step?
That's a good question. But what else?
Maybe it's good that we go back in time, like you try to project yourself in the time
Yeah.
where, like where you did that. Like what made you go out there? Like what was your like thing, like I gotta do this, like I gotta move? Like what was the tick? Did someone push you? Was a friend that told you to go out there? Like were you just ambitious to do it? Like what was your take?
I mean, it's good to take a journey with people that you trust and trust you. That's one of the greatest push that will make you go through a situation. But for me, I think believing in myself is one of the things. So believe in yourself, and you lose nothing to communicate. I mean, the more you're open to collaboration is a two-sided sword, but the more you're open to collaborations, the more you learn. if you appreciate what you cannot do and you go out looking for it, the more you succeed. And for every time you go out, always be cautious about what you're looking for and what you're willing to give for what you're looking for. When those are clear to you, then you'll know when to
Cool.
move out and how to move out.
Cool. I think that's spot on. Like the ability to believe in yourself, the ability to put yourself out there. And I think that comes also with the understanding that, you're willing to take feedback and you're willing to fail, but most importantly, to see failure as a continuous improvement mindset. So I really appreciate your time, Brian. I know it's a hard time for all of us, and especially for you, because I think you're going through a lot of things right now with COVID. So I really appreciate you taking the time for us to have this conversation.
Awesome. Thank you very much,
All
Pedro.
right. Thank you. Thank you, Brian.